everybody, welcome to the Coming Out Forums. I am Dr. Lisa Cook. I am your host. I'm elated today to be sharing with you as our focus is women, supporting women, getting to their next level by being real and authentic. Here we believe the truth is undisputed. We believe the truth in our lives needs to be shared, and as we reveal that truth, we can walk on our purpose and our power. We have so much power waiting for us just for us to tap into it. With that being said, everyone, let's start coming out. Hey, everybody. Welcome back to the Coming Out Forums. This is Dr. Lisa Cook. I'm your host, and we are excited again to have another conversation and uplift a topic today for our podcast. And today we're delving into this topic called Everything You Envisioned Can Be, the journey of becoming what you dreamed. And so, as I often do, I like to kind of start us off with some reflective points. And so I started to think about the idea of what is a dream? And so, how do we understand that word to me? And so, in one definition found in an article called Dreams versus Goals, the Differences Matter, it describes a dream as a series of images, thoughts, desires, emotions that pass through your mind. It's driven by the creativity of our minds and imaginations that we have, typically around something in the future. And often it is something we wished or something we want to achieve someday in our lives. And so I thought when we think about this conversation around everything you envision you can be, I'm really excited to unpack how our special guest, how she envisioned where her life would be in her journey, her dreams, and how she brought that to fruition. And so I think she is poised to give us kind of the realness of her life, the realness of her journey, but also how when you have a dream, what it looks like, how do you move forward towards that and take those intangibles to tangible, actionable things. And so again, I'm excited about that. So let me introduce to you our special guest today for our conversation. She is Dr. Tanika Shepherd Davis. She is she's a DNP, WHNP, BC, EPC. And I'm going to ask her to please explain what those letters mean, accompanied with her name, with her obviously with her accolades and her accomplishments when she opens up. But she is a woman that's dedicated to women's health, and she's a women's health nurse practitioner over 2 decades of experience with high risk obstetrics, gynecology, family planning, education, and clinical leadership. She earned her, I want to say this is a doctorate in nurse practices? Okay. And her master's in nursing from Texas Women's University and her bachelor's in nursing from Prairie View A&M University, both institutions that have helped shape her commitment to community-focused care. I love that. Tanika currently leads 2 women health centers in Dallas County, where she advocates for compassionate, high-quality care for underserved women. She's also a published author, a speaker, a mentor who finds joy in guiding the next generation of nurses. Beyond the clinic and the classroom, Tanika enjoys watching historical documentaries. Oh, I love that. Reading both audiobooks and print books, traveling, spending time with her family, and her life mission to live with intention, live with authenticity, and encourage others to do the same. Oh, you're perfect for our podcast. Because we believe that women should walk in their power, walk in their truth, and and living in their authentic truth is to me power. And so I'm so excited to welcome to the Coming Out Forum, Dr. Tanika Davis. Welcome to the show.
Oh my goodness, thank you. I'm gonna say this, Lisa, coming in. I have often over the many years have heard other people's bios when they're getting introduced to, forums or engagements. And I sit there and I think to myself, oh my God, they've done so much.
Yeah.
I'm like, oh my God, was that mine? Oh, that was very humbling. Thank you.
Yeah, it's wonderful to hear the work that you put in, right? When you hear someone read it back to you. So outstanding accomplishments. And so as you open up today, tell us a little bit about I gave your those initials that accompany your
Right.
name and your accomplishments. Tell us what those all stand for.
Okay. So a year ago I earned my Doctor of Nursing Practice. So that is one of 2 terminal degrees you can get in nursing, the other one being a PhD. The difference is that the clinical doctorate is a practice implementation degree. The PhD is a research degree, finding out new things, we're discovering new ways of doing, thinking, being. And then my degree, my doctorate is let's put this into real life, into action. Let's make
Yes.
these things that we learned work.
Yes,
And
excellent.
so, yes, so I am more of an implementation scientist rather than a researcher.
I love it. I love the distinction and help thank you for providing that for our audience. And so equally both, in my mind, the work that you put in towards becoming from an implementation scientist to a researcher, right? There's still, the work that you put in, the time and commitment are to me just equally as valuable. So I appreciate you open that up to our audience so they understand what that means. So let's just talk about the conversation. I know that in your station in life is we know that clearly that you are a woman, a female, a mother, a friend, a daughter, right? A career woman, certainly. I want you to tell us from your personal standpoint what this topic means to you. Everything you can envision can be the journey of becoming what you dreamed. What does that mean to you in your practical terms?
So, you know, I think I've arrived at this place. I just didn't, instantly get I arrived. So I got that quote from a book by Brianna Wiest, and I've read 2 of her books or am, perusing, or I've read one in entirety. The other one I use as I need to, but
Mm,
it resonated with me because when this happened to me, I was at at a pivotal point. I don't know, if you know that my sister passed in childbirth. So that was affecting me. This was right when I turned 40. My son was in high school and, he was starting high school. He was at a critical time in his life. I was having still continual problems, with my marriage. I had some difficulty there. I felt still in my life, I hadn't gotten to a place where I felt like I was living the fullest version of myself. And when I began to do some work, I came across that book and it just, I felt like there was something in me that God had placed in me. And this vision that I had in my mind, you see in your mind's eye where it is that you want to be and where you want to go. And there was a disconnect between that place and where I was. And I felt
yes.
so strongly that for women at least, I know he gives us intuition, and that's how we protect ourselves. That's our wisdom. That's our guiding post. And I know it's him, but I'm not there. So I started to journal. I started to do work, and slowly over time, those things began to line up. I realized that I was manifesting a long time ago the life that I was supposed to have. And now that I began to take steps towards it, it started to find me.
Mm, mm.
So that's what I mean.
That's great. Listening to you describe it and so honoring the experiences that brought you to the pivotal moment of the loss of your sister. It
Mm,
sounds like the marriage, just where you were at in life, you were a parent, and just the idea of recognizing that now doesn't seem like it's a miss in the sense of I see myself totally different from what I'm actually living and being,
correct.
right? And having that awareness, Tanika, to be like, "Yeah, I'm at this pivotal road, and what am I gonna do? Like, what am I gonna stay stagnant here? Am I gonna, try to move towards the thing that I believe that I can be?" And that is truly in your mind, like, you believe and see yourself totally different sometimes than how
It's
you felt.
almost like, because I
Yeah.
was saying to myself, like, am I crazy? Like, why am I so discontented? And then to bring these things up and into your real life, and then the people that are in that life with you, they're like, "What are you talking about?" Like everything, and I'm like, "Oh, there's something off." And to be met with whatever,
Yes.
"You sound crazy, girl. What are you talking about? You gonna go to school again?"
Yeah.
Yeah.
That's interesting point you make because sometimes when you envision your life to where you want it to go and see everyone around you doesn't see the vision, right? That's what you got, that's what God gave you, and they may not applaud the vision, they might encourage the vision. So this does become from a self-driven,
Yep.
even biblical or spiritual driven thing that you set inside your heart. As you said, God placed clearly into your mind's eye and your
Yep.
intuition your wisdom to keep moving, even though people around you didn't
Yep.
necessarily see where you're going. So that's a point for us as listeners to, sometimes everyone doesn't see you, and mostly they don't because it's your vision.
Even doubt, am I doing too much? Am I just is this how can I say? I don't wanna say is it vain or is it selfishness? Am I just completely off course, you know? But I
Mhm,
had to remind myself, and I even spoke this out to my husband at the time. I said, I can't reconcile why I feel so strongly about whatever this is.
mhm,
God didn't give it to me.
mhm. Yeah, exactly. So it was so cemented in your heart and soul, you knew that it was from a divine
Like,
source.
I can't because if you it'll
Mhm.
go away for a while, but it bubbles right back up to the surface.
Excellent. So when she's describing how she got to this point of envisioning, everything you envision you can be, there was things she was reading, there was experiences she was having, but then there was a voice within her that
Mhm,
just kept
mhm,
coming alive and just kept reminding her, there's more that you can do to live. And you said the fullest version of yourself. And there's more to do to get to that place. And so it's a journey. It's not always the destination, but you do find yourself as you start moving in that direction, feeling, oh, okay, the alignment of where the vision is, right, and what you're doing in your life. So I love that
mhm.
as we're looking at this, what it means to you, thank you for bringing that into alive for our audience. In your life story, how do you view the importance of pursuing the dream or vision? You just talked about that a little bit, but I don't know if there's more you want to expand about that. The importance of pursuing it, the vision or the dream that you have.
Yeah, I kinda had to go backwards to come, to go forward. I had to go back because I wanted to know, first of all, for me, and being a Christian, this was a challenge too because I dealt with a little bit of trauma in regards to that as well, especially surrounding my sister's death. I was upset with God.
Yeah.
I lost a little bit of trust in him,
Mm-hmm.
and
Hmm.
so I started to kind of explore other avenues of, I guess, getting answers and support, and knowing that I had the word in me, it was tough,
Yeah.
but I had to look back to say, okay, Tanika, why did you get to the place that you were in to even be disconnected like that?
Mm-hmm.
To be off course. Like even externally, I was so just dull. I think it went back to how women, specifically Black women, girls, are conditioned to just be accepting of
Mm-hmm.
whatever state you're in and to accommodate that.
Yeah.
We're little grown adults when we're
Mm-hmm.
kids, and I'm the oldest. I'm the oldest grandchild my grandmother had, my mom's mom. I'm the oldest there. I'm the oldest in my family. I'm the first in my family to go to college. I'm the first quote unquote to be successful, if that's
Mm-hmm.
if that is a thing. You
Mm-hmm.
know, I had the first boy in our family. So it was just, like I have to now live and love myself more than I live and love for everyone else. And I think that's how I got to the place that I was in. My boundaries, I was just way too porous.
Yeah.
I
Yeah.
had no so I had to learn to pursue me first. I had to learn to say, it's a no for me. If I felt even like in my adult life disrespected or excused or ignored, I never really spoke up to that. And I started to shift when I realized that that's probably why you're not aligned with the person that you want to be. All of it matters, so I had to pursue me first, pursue and reclaim myself from
Mm-hmm.
being everybody else's something
Yes.
and be
Yes.
that for me.
Yeah, that's such a powerful statement, reclaiming yourself and recognizing uh, the truth around how culturally we are conditioned as children as well as girls, then as African American Black girls, right? Or whatever nationality. Exactly. There's a societal conditioning, right? There's a cultural condition, whatever ethnicity you come from, there is a conditioning. And so then I think particularly to the point of you just accept what life brings you, especially that old school. We're from
Mhm.
Mississippi. That cult that what is this life? You're gonna just bear with it, and
You
pray.
stick with through thick and thin, blood is blood, it's thicker than water. No, baby.
All that. And so
Okay.
then you come up against that ideology.
Mhm.
That's challenging to the climate of your world because your worldview is your people, is your culture, right? And so, and then to have what you described is a loss that was so profound with your sister, and you are a Christian, and you have that spiritual foundation, but then you're thinking, okay, God, would you allow this to happen? This magnitude, right? So questioning all those things, right? And then you come through that, as you said, as you kind of, I had to look backwards to see what got me to the point I was, and then how do I make sense of the importance of me continually moving towards where I want to be? I had to reconcile and reflect on all those things, and then come to the point of what you described. I had to pursue me first, and I know in there's a thin line there in this in the Christian faith around how we pursue self or love self, and it relates to the word says around, loving God, love the Lord our God. So there's a scripture I think is in Matthew 22. Is it 22? I'm gonna make sure I may be messing up the verse, but I know it's Matthew, the 22, 37 through 20 and 20, 39. It says, the first commandment, first great commandment is to love the Lord God with your heart, mind, body, and soul, all of you, right? And the second commandment is to love your neighbor as yourself. And I have done some studying on that. Because I too went through that journey of self-love and reclaiming self and pursuing self. And I thought, how could I get it. I can love God over the totality of me. Then how could I love my neighbor as myself if I don't actually love myself? So I had to kind of come to this journey of loving myself, but it's wrapped up in me loving God and God loving me. When I can have that connection with him, and knowing that how much he loves and pours into me, I can receive the thing that he's offering to fill me to a level of love from God, love for self, to then extend to others. But to your point, if you, that is a miss somewhere,
Mhm.
it's like, okay, I'm giving, I don't know where to stop.
Don't even know who you are.
Exactly.
They tell us this on the plane every time we get on the plane. Put your mask on first.
That's right, because you can't save your child, anybody else, unless your mask is on first. And so I think we have to reconcile the idea of reclaiming self, pursuing love for self is not a negative thing. It does help us come to a place of really understanding and fulfilling us, who we are and our purpose, and be able to have boundaries, be able to see what we want to go and go where we without giving everybody all of us and then being depleted at the end. And so I value that point. I value the journey and the struggle of God, I'm not trusting you right now. And but that's honest because if we're honest, we all had things in our lives that have made us question that what
Mhm.
God is doing, right? And so I appreciate that transparency. And so as I think about the idea of why it's so important is that you have to keep coming back to self and keep coming back to pursuing self and reclaiming self because in line in that is your purpose and your vision and your destiny where you want to show up. But you gotta know that and you gotta see that. You gotta be honest about that. So thank you for that. So what the question I have here is when women in general, when you think about women in general, how did you navigate managing all the roles that you had to fill in your life, the balance of pursuing this doctorate degree? Clearly I know you were working meant you had a son. Like, I know you had a lot of, hands in the air. How did you manage that? And what would you offer for women?
Well, first I wanna say this, we are awesome,
Yes.
and I think that the world would fall apart if it were not for women.
Mhm.
Really, I do. All women in every culture, every country. We truly are the backbone of society, and if we were not here, nothing would get done,
Yeah.
nothing. So, I say that to say that I did it as best as I could, and I failed on some levels, I know that I did because, I think in that I went to school twice while I was married. One to get my master's and then my doctorate, but I didn't do that until my son was going to college. He
Mm,
was at that point. But I think the casualty of all of this was my marriage. I think that was just pretty much the final nail on the whole thing. But I did it the same way that most women do it. We just do it. We
yeah.
just figure it out. My house was not as clean as I wanted it to be, but I cleaned it about every, I don't know, maybe once a month. I stopped cooking, for the
Mhm.
most part because I was working and going to school. So it just It just happened. Life just happened around it, and you find little pockets of time. You go to bed late, get up early, you say, "You know what? Not today. Today I'm going to sleep." So it just happened.
Yeah,
I don't think there was a spell or a potion or even a system. It just happened.
just happened. So I hear you saying so it just happened, but what the basis of it just happening was the fact that you wanted to finish, you wanted to pursue, you wanted to
And I actually got to a point midway that I just about quit.
wow, okay.
I did. I got to a place because, I think being a young adult and going to school, secondary school, college, and everything is different than being in your midlife and you're in perimenopause and you don't know it.
We have a whole 'nother conversation, and I'll have you back to talk about
And I hope I can say this without getting in trouble, but is shit crazy or something really wrong. And you just don't have the patience, you don't have time. I just wanted to come home and drink a glass of wine and watch TV. I didn't want to do
Mhm.
it,
Mhm.
and then I have an assignment, I have a paper to write. And I'm like, what?
It's intense. It's intense. If you have not went through perimenopause or menopause, it's an intense it's an adjustment, and again, I promise you, Imma have you back so we can talk about
Okay, we can
because
talk.
that is a topic in itself.
Uh-huh.
He says,
Yeah.
"Oh my goodness." So, it just happened. You just,
Mhm.
you went through the process, you acknowledged there was some casualties of you pursuing this, in your relationship, with your husband, but
Sister, my mom.
yeah, just the lack of probably time and availability and accessibility that you were able to give for you to finish your degree.
Right.
And so as I think about for other women as you're navigating, you may just be doing it. You may just be making it happen, which we do. We get up, we go to work, we take care of the home, we if we got classes, right? We and then we try to find pockets in there. And I think that the thing about it is to have an honest assessment of where you are in this journey. If you're overwhelmed, you're tired, make sure that you can honor that in some form or fashion because we are wired to just keep going, keep doing it. Yep, and then even sometimes we're casualty
Mhm.
of the right, we're a casualty of war. We're trying to pursue our dreams, and so being mindful. You talked about the catalyst, I believe, already. With you talked about the pivotal moment, but I want to know in your life as it shifted to your awareness of everything you can envision can be became your mantra for life, was it all the things you mentioned earlier, was it one thing specific? You mentioned the loss of your sister, you mentioned kind of where you were in life, was it one thing specific or was it all those things combined that was a
It
cat?
was everything combined. It was all of it combined. I think
Yeah.
too, like I mentioned before, there was just this underlying sense of misalignment that I just could not put down.
Okay.
And I started to really focus on, like, for example, like me. I wanted to improve me in the sense
Mhm,
that I didn't want to find myself in the same place in another because I had these moments all throughout my 20s, my 30s, and I thought that I would be at a certain place by this time or here or there. And I had to remind myself, like I even told my son, I said, everybody's journey's different. Go through your life expecting things to look like it looks for other people. Your journey
mhm,
is your journey and it's yours for a reason. So I had to kind of reset, level set, and tell myself that. But it wasn't any one thing, it was all those things combined.
mhm,
And I just knew that I was not living authentically out loud and I was tired. I
yeah,
was tired of hiding. I was tired of explaining, excusing. I was tired of just being accommodating and all of I just wanted to be and be
mhm,
free to exist, and however that shows up, unapologetically
mhm.
free.
Unapologetically free. Oh, what a wonderful place to be. Unapologetically free. And so there is a new mindset though has happened for you, correct? Like
Mhm.
this transition has shifted your mindset. And how are you seeing that show up now? Is unapologetically free. That's a whole new
Right.
mindset. How are you showing up with that today?
I'm showing up with that today, even though I still have moments of self-doubt, I still have moments of fear, I still have moments where I think to myself, "Am I doing the right thing? Did I make the right choices?"
Mhm.
Because I've made some drastic choices, lately. So yes, I actually did a presentation to the doctoral group that were coming in behind me about
Mhm.
mindset. That's exactly what I talked about with them because I have had a paradigm shift. I want to be loved for the person that I truly am, not for the person that you want me to be.
Yeah. Yeah.
I want to love someone out of the abundance of who I am now, not out of the lack of who I was,
Mm,
or the
mm,
need of who I was, or the fear of who I was,
mm,
or
mm,
I have to present in a certain kind of way.
mm,
I
mhm.
want to I wanna go get my facials, I wanna get my massages, I wanna live the life that I think that not so much that I feel I deserve, but that feels like it is really who I am. Not because, I'm gonna go and give myself a treat. No, this is who I am.
This is powerful stuff because if we can come to a place from the idea of envisioning everything you can envision can be, and like take that theoretically, because that's a premise. That's aspirational. But to take that and say, okay, as you've described, life experiences and analyze myself and look at what life has brought and see, well, but there's this bubbling up inside of me that continues to emerge. And I need to align this thing that keeps coming up in my life into the vision. And so when I'm able to finally accept that and walk into that and believe enough in myself that I can do this, then my whole transition, my whole self, everything shifts to another angle of life, right? I see life. And so and so you said, I love this point of, I want to love out of the abundance of me. I wonder how many of us as women have loved out of the lack of, right, of the lack that we carry. And so when you think about to your children, to your spouses, boyfriends, whatever, partners, you are not really giving them what you think that you're giving them because you're operating out of a deficit. I call that like our love tank. It is at zero, like mostly, or it's on, below zero, right? And so, like, the capacity to give what you really truly could give if you actually come to a place of transformation, of reclaiming understanding
Mhm.
yourself, making self be the person that you love and care for. Because now, as we just talked about, if I can receive the love of God, I can fill my love up. I can love myself equally. Simultaneously, I can actually then show up in the abundance of who I am and
And
be okay with that. Go ahead.
I think it was prophetic. I think I was speaking to myself because I remember from the time my son was very young, I would always tell him, you know, I would ask him from time to time, "What is your name? Who are
Mhm.
you? What is your
Mhm.
name? Say your
Mhm.
name. I wanna hear you say it."
Mhm.
It.
Yes.
And then I would tell him, "My dream, my hope for you is that you are a whole, complete person.
Yes.
Feel complete and whole in who you are, and don't excuse who you are to anyone, even me.
Mm.
If it's something that I'm even and now that he's a young adult and he's finding his way into life, I tell him, "Now you're a man." I say, "So if there's something that I say to you or ask of you or even just and it doesn't feel good to you, if I brush up against a boundary, let me know.
Yes. Yes. Yes.
Respectfully, but let me know."
Exactly.
You have to I want you to be able to establish that now for yourself because I didn't do that. And I don't
Exactly.
want you to find yourself somewhere later like, dang it.
Awesome. That's what's your name? Who are you? Right? And if you can look yourself in the mirror and say, I am, and this is
Mhm.
who I am, and this is how I will be. Those are powerful self affirmations and conversations to self to really define. And if you look in the mirror and say, "My name is, Lisa Cook or Dr. Cook," but I
Mhm.
don't match her, right? Into what I think
Who's
this
the
name is supposed to,
match?
right, right? I need to do some assessments and I need to find where we match. I need to find where we match. So I can then be unapologetically free. I can then live in the essence of who I am. And so I hear that loud and clear that your journey of where you have moved through your life is brought you to this
Mhm.
place. So it's not just one thing, it's several things, but even in the point of a loss in the journey, there's still gains in this journey. There's still so many more things that you have been able to gain in this process. And so I'm saying this 'cause I want the audience to understand this life is so interesting because you start off as a child, you have dreams as a child. You think you want to grow up and be this. And then your life starts to emerge in something that maybe not be anything that what you I used to say I wanted to be an attorney. I don't even know where that came from. I don't even know. But that's what I thought I wanted to be. And so I thought that I would, do things that kind of get me along that line. But I ended up I'm in a whole different I'm in a behavioral health profession. I'm nowhere near an attorney, right? And so but that's where my life shifted to, but this is right for me because when I look at who I am and my purpose as a clinician, as a woman that I like to be able to inspire and uplift, and then I can do it. I work professionally, but I do this my counseling as on my side business. But yet, I know that's my purpose, right? I know, so I know that alignment makes sense. So I'm saying that to say is that you can think one thing as a child, and life experiences and circumstances, but the thing that comes back and keeps emerging up to you is where you're trying to get to is the vision, whether it comes from God, whether you see it yourself, where you want to get to, so you can feel yourself operating in, I feel, in your purpose, in the freeness of who you are, in the most authentic space ever. And everyone doesn't agree with that, and that's okay.
Like when you're there, you can stand 10 toes down and
Yeah.
feel so grounded.
Yes.
And it doesn't matter what the other person's doing, there's gonna be overlap with other professionals, but it still doesn't matter because it's your space.
It's not exactly.
Yeah.
And you're meant to hold that space. You are meant to hold that space in this journey of life, and I believe everyone has that if they can
Mhm.
get to that. You're meant and so the space that you are in as Dr. Tanika Davis, that's the space you're meant to hold in life, right? Because then you're able to you're able to then impact other people because you're in the right space. You're in the right space and for your journey. So, if we can, I wanna transition a little bit to the work you've done, a doctoral implementator. And so I want to talk about your doctoral quality improvement project that you did, and it is called Implementing Emergency Contraceptive Practice Guidelines. And you worked along with some other individuals, Shalon Harris and Jennifer Wu, both of them equally it looks like one is a PhD, one is a doctor in nurse practices as you. And so you guys work together to bring this emergency contraception practice guidelines into practice. I want to talk about that a little bit about that and just a little bit if we can, and because that's a part of your journey. Why was that important? And especially because you're in healthcare, you're in women's health. Why was that important for you to talk about or work on this particular area?
Okay. Well, for 2 reasons, and I'll circle back to my sister in a moment. But specifically right now, we know with the current politics, we have restrictions on abortion care, and we even have, in some ways, restrictions on reproductive health care.
Mm.
If you don't have your own employer based insurance or some type of publicly funded insurance, i.e., Medicaid or Medicare, for the most part, you're kind of in a rock between a rock and a hard place. And if you can, have access to that through Obamacare, which was meant to make things easier for people who could not otherwise, right? There's been exemptions built into that. So if you work for a religious institution or if you're even seeking care at a religious based healthcare facility, they can make certain, concessions as to what they will offer you. So
Yes.
I say all that to say this: abortion care is very nuanced. Reproductive health care is very nuanced. It's not as black and white as abortion is illegal and we shouldn't be killing babies. That's not in the mainstream what women do.
Yeah.
I know that we as women know that in our core being. We know that, you know, generally speaking, we make those decisions from a place of, my gosh, I would say turmoil, extreme contemplation of your
Yeah.
faith, of your personal values, of your
Yes.
personal well being, your family. You're looking at so many things.
Great.
But that's not what this is about. I
Mhm.
feel that this was about mandating to me, just in my opinion, as a professional, as a person, this was about mandating who was worthy enough to have a sexual life,
Mm.
was worthy enough to raise or not raise children. This all goes back to just reproductive justice in general. So, with the restrictions on abortion care, with some of the difficulties women have with accessing contraception, and women have with, even when I say accessing contraception, not just to get it because they want it, but not being able to get it because they need it. Birth control, that's emergency birth control, is meant to be a fail stop for women to prevent a pregnancy that they otherwise would not be in the position to have or
Mhm.
medically healthy enough to carry. It's very effective. as healthcare providers, we do a piss poor job of offering it to women when we realize that, or fail to realize that they need it. So in my practice, women come in hours, days of having had unprotected sex, coming in to start contraception or not.
Mhm,
And we're not even recognizing this is an opportunity to help you, to
mhm,
educate you. You can go down the street to the drugstore. You may or may not find Plan B on the shelf. It's $50,
yes,
for one tablet. I
mhm,
tell my son this too. I said, listen, I said, as a man, you don't have contraception for the exception of a condom, with the exception of a condom.
mhm,
This is an option for you.
mm, mhm,
No, this is an option for you to have for you as
mhm,
birth control. So it's important. Roughly only about 8 to 10% of healthcare providers even tell patients about it. Generally, in the general population, only about 20% of women have ever used it.
okay,
And it's not an abortion pill. It
right,
prevents ovulation. It
mhm,
prevents you from actually ovulating so that you
yes,
don't get pregnant. Yeah.
yeah. That's that's an interesting thing is, I think it seemed like for a moment in time, they were offering commercials around it,
Mhm.
and then it just kinda went away, right? And I know there's I used to work at a limited medical clinic doing counseling for women who were having had an unplanned pregnancy, right? And to your point, that's the decision whatever decision they make is not taken lightly. That is a tumultuous moment in time, particularly if you were not ready from emotional, mental, physical means, right? Anything to have that child. And I agree with you. Sessions on top of sessions with just the women struggling on these decisions. And I remember one thing that stood out to me one day. I wasn't even working that day. I was actually somewhere else, and I remember getting out of the car and listening to this woman. She was, like, going off, like, cursing, and I was like, "Wow, who is she talking to?" She was just like all the names you could think about of to whoever the person was, and I looked up, and she was talking to, like, a two-year-old child, and it struck me, and not in judgment, it struck me that this is why we really need to consider our readiness, right, for parenting, because sometimes we just from every angle, whether it's financially, emotionally, stability, whatever it is, we're not ready, you know? And because then it can result into that type of scenario. And, you know, but on top of the fact, again, like what you noted is that it's not an easy decision to or not to. And I think understanding that as women, we do know that, but other people probably don't. And another example I would give is it was another young lady who came in and the conversation was promoting her to continue the pregnancy. She didn't have a place to live. She was living in her car, and so there was no means for her, and I said to the people on the agency, I said, "So if you wanna promote her to have this child, what are you gonna do after the child's born to help her raise that child? Like, she needs a home, she needs her family had turned against her because of the pregnancy, she needs all these things, so if we wanna promote continuing pregnancy, which, hey, do whatever you choose to do,
Let's
but
truly be pro-life.
exactly, let's promote her all the way through so this
Mhm.
she have a stable home, the
That's
child can have
correct.
stability. She needs beyond the decision support. She needs all of these things. And so to your point, it's like it's not just this simple thing. And I think that we have these conversations based off the religious and political views, but there are so many other factors to bring it to the table. To the study, I mean, to the work that you did around the Quality Improvement Project that so many clinicians today are not presenting this is interesting to me, particularly because it's not really, as you say, an abortion pill.
Uh,
It is a, you know, a
it's a
method.
contraceptive.
Correct. And that's so yeah. So I'll let you respond to what I was saying. So
Yeah, I also wanna bring up this point too, and I didn't speak to the success of the project. Now, in the project, we had, like, just by implementing the practice guideline, because in being the implementation scientist, we use the evidence through research.
yeah.
We take that and we use that as the framework for what we are implementing. It's interesting that and most of the time, that information already exists. We're just not using it, right? But with doing this, we had an exponential, like a 73% difference in the amount of women who actually said, absolutely, I will take that
Wow.
because I'm not ready for a baby.
Yeah.
And if I have a chance to prevent it, not then go abort it.
Yes. Yeah.
And I would rather take that opportunity
Yeah,
than
absolutely. Yeah. 100%. And I wanna and I know you mentioned a little bit too about your sister. I don't know if you want to speak to that with this that drove you around this well, but I think that there are significant psychological ramifications for women. Even if you make the choice to abort it, even if you make it in acceptance
Yes.
that you do it, it's still psychological ramifications. And so I think that piece of the puzzle also is probably never lifted up in the context of how we help women and things. Yeah.
And I'm just coming at this from a contraceptive standpoint.
Correct.
We still need abortion care for other reasons.
Yes. Yeah.
Medical
Yes. Yes.
and even looking at this from the standpoint of contraceptive, necessity and just political, I guess, dogma, women do not get pregnant in isolation. We have no laws that are mandating or regulating any aspect of male reproduction. But I digress.
We could talk about that. So you talked about 73% of the women in the study opted for the
Yes.
contraceptive, emergency contraceptive. And with the clinicians and the practices, is this something that you see that they are now continuing to practice, or is it kind of they did it for the period in time
Yes.
and kind of moved away from it?
So in my practice facility, we're very heavily protocol driven. We have probably probably in Texas in any one institution the largest number of advanced practice nurses or what we would call in some spaces mid-level providers. And we were heavily in Texas, we're heavily regulated by physician oversight. Coming from a place where you're very protocol driven, if it's not in the protocol, if it's not in the policy, we don't do it.
Yeah.
And that was one of the issues. So it's now in the protocol, it's in the policy,
Yeah.
it's there. But I think another aspect of it was just the wrapping the mind around thinking about emergency contraception first. And yes, they were very, very attuned and excited about the project. I think one of the issues that I've had in keeping it going is that I haven't been attentive to the project like I was because I'm now in management. Yes, it's in the protocol, and we're actually right now trying to bring on more effective methods of emergency contraception into the clinic because Plan B, specifically, which was my project, that was my intervention, it's not as effective for women who have higher BMIs. And we know the majority of us, have a slightly higher BMI, which is not an issue. It's just that particular medication is not as effective. And you only have a 72-hour window.
Window. Yeah.
There's some
So
others that are a little more effective.
effective. And so it's body mass index, right? BMI.
Yes.
So
Yes.
if you have a higher BMI, you're finding that um
30,
30% of
if it's
effectiveness?
30, if your BMI is 30
Mhm.
or up, a plan B may not be as effective for everyone who is listening. Please don't assume that it will not work. It may not be as
Yeah.
effective,
Okay.
but there are more effective options.
Okay.
Yes.
Okay. So that's good. That's good information to know. So like knowing the totality of how the medication or how the contraception will work for you. So that's good. So looking at the project, looking at implementation, looking at how it's working, looking at is it just your clinic that you're utilizing, or did you see other clinics across, or has it moved more nationally? Is it still kind of localized?
Okay. So within my system, because yes, globally, DNPs work all over the spectrum of healthcare. But in my institution where I am currently working, we have 11 women's health centers. This change rolled out to all of them, but the project in and of itself only occurred at four. But
Okay.
yes, yes.
Excellent. So it's moved beyond just the 4 to the, and I'm hoping that one day you'll be able to take this, and you and your co implementators, and we'll be able to take this and move it across other maybe facilities,
Oh,
across the country.
Yeah, currently, depending on the state, depending on the facility, Plan B is right now part of a standardized care plan
Oh,
for
excellent.
sexual assault. So let's be clear about that.
Excellent.
It
Okay.
is recommended as evidence-based practice, best practice for any woman who has experienced a sexual assault because you
Okay.
want to try to prevent a pregnancy that could occur from that because that is re-traumatization. And that's not trauma-informed care to make a woman carry a child that she did not decide to procreate. That was she was a victim of a crime.
Yes.
So, but not every state requires that be required. So, again, to your point, yes, that is again a bigger, broader project in terms of getting that. Yes. Mhm.
Cross. Okay,
Yeah.
makes sense.
Mhm.
So this is good. So you were driven to, and I'm gonna look back at our questions because we're kind of talking through them without me asking them. So I want to make sure looking at some of the things here. It's kind of shifting back more to the personal and still staying in the work vocational conversation. But I want to ask you this question. And I'm gonna actually go back to this question, but how do women in the medical field who could be facing burnout, maybe functional depression, or other issues express their needs and vulnerabilities and find strength? From your experience, what does that look like practically?
Basically, I would say a good support system, a good friend network. I find that nurses tend to befriend other nurses. And so we understand each other's stress and
Mhm.
burnout. We understand that very well. It's similar to like, in your work and even in mine, and finding a healthcare provider or a mental health care provider who identifies with you culturally or in
Mhm.
ethnicity because you don't have to explain the subtext. You don't have to explain
Mhm.
the
Mhm.
nuance of how you present in the world. So it's similar to that. I think that we understand as healthcare providers that and as women, we are nurturers, and then as healthcare providers, we are nurturers. You tend to give so much of yourself that, it's important to have that support system. So I say a support system. And then having somebody that can tap into and say, "Are you okay?" Because we do tend to be more of the heroes in everybody else's life, but
Mhm.
our own. And so,
Mhm.
they always tell you to check on your strong friend. Well, you do. You really do need to check on your strong.
Yeah, that's good. When you were speaking about that, I was thinking about the idea of finding people that feel safe for you. And so, I've had several nurse clients in the clinical practice, and, I didn't know, I'll be tell you this, and I guess maybe I just not that I didn't know, maybe I just didn't pay attention to this high stress that nurses go through, and because it wasn't, it's not on my purview, so, and I was like, "Wow, there is really a lot of intense
Mhm.
things that nurses endure day to day." And so and just in the medical field, period.
Mhm.
Life or death, and all these things, but I think people don't really consider that. I know I hadn't considered it. So I can imagine the high levels of stress, but then being driven by, as you just mentioned, nurses are kind of nurturers and things like that. So you're still like showing up and giving, but yet not tapping into see if you're okay.
We suffer a lot with compassion fatigue. And
Mhm.
then so in your real life, when there's and I'm going to use this is a perfect example. So in your real life, when something shows up for you, you don't even know how to tap in because in your work, we're taught to be empathetic and to show compassion for our patients and their family. But along with that, you do have to maintain some type of disconnect because otherwise you would be emotionally stirred and crying and involved and invested in everybody else's experience. And you can't function in a job because it is a job. You can't function that way. So when my sister passed, I was at that time working, managing a labor and delivery unit. And it was a 24-hour unit. It was very stressful. I work for the county hospital system. It's extremely busy. I had 40 plus employees under me. And so when that all happened to me personally, my sister dies in childbirth. She's at a facility that's connected to my own. So I know some of the physicians. Her physician was my OBGYN. I know these people. I couldn't. And then it happens. So now I'm the oldest sibling. I'm trying to take care of my mom. I'm trying to take care of everything. I'm in the mode of fix, fix, fix. So
Mhm.
that's what I'm saying. We're always taking care, right? I didn't mourn my sister for almost 6 months.
Yeah,
So I didn't, and then when I go back to work, I don't have a place, you know. So that's what I'm saying. We need a very strong support system
yeah,
when you're caring for other people.
yeah.
Need somebody to check on you.
Yes, that is such a thank you, and the loss I understand, and
Mhm.
I I think as you're sharing that, I think that's such a well, it's a tough thing to bring out. It's such a real story around how your profession requires you to do all these things to give and take care of, and then you lose your sister, and not even like it wasn't like some foreign situation because you just described you knew same doctor, same you knew the so I can even imagine just the feelings that you had around all of that within the medical the
I
medical people, that you were, used to dealing with.
I didn't want anybody to touch me.
I mean, right, right, and knowing what about that when that happened, I know I just from a distance, I know of that, hearing about it, right? But then you experiencing it, it's just, I'm sure such a just a hard time to
It
manage
was. It was.
through,
It
and
was. It was.
and
It was.
so wanna just, say to you, sorry for that, but honestly, wanna just employ your courage as you talk through even now, because I know that even though you mourn, but things come ebb and flows, and just the fact that you're as you bring lift it up today in this conversation, I wanna honor that and honor your courage in that. But you talk about how much support is necessary, and even in that space for you, you were still trying to help other people, that
Uh-huh.
you
It
had your
was my
own
job.
yeah, you had your own pain and sorrow, and so I say that, like, that's why the question, like, you're in this field, but, like, how do you address your own vulnerabilities?
Think healthcare is starting to take a shift. I would say this first. That we're starting to recognize that we are human beings. We're not machines, and we don't go home and plug ourselves in at the end of the day.
Mhm.
Um, so, even with the violence that healthcare providers face, patients are violent
Yes.
with us. They assume that we are there to be their all in all, and including their punching bags. Like they lash out on us. We have programs now that try to support healthcare providers in that space. If you are a victim of violence in the workplace, is what we call it, then you get a mandatory number of days off from work.
Oh, that's
Somebody to then we have a network of people to tap into. Um, but yeah, I think for me, what I had, and this was part of that pivotal time for me, I had to figure out how I first wanted to show up for me
mhm.
because I didn't show up for me when my sister passed away. And I say this only to say that when I went back to work, I didn't tell my employers, hey, I need time for me.
Mm,
I can't, I'm not healthy enough. I'm not well enough to do this. I
mhm.
just went back.
Yeah.
So for me, I wasn't what I'm saying is that I wasn't loving me enough. So I
Mm,
think it all started with me coming back to a place to say, okay, what do I need to show up for me first? And then I can say, okay, now I need your support. I need you to do this for me.
mm.
I need you to be in this hold this space for me, or I need that, or I need this. And that's when I began to understand how I could garner support. And then even still, I had to remember just to be strong enough for myself. Like I gotta there's things people can't do for you.
Yes, that's right. That's right. That's right.
You just gotta walk through some things.
Yeah, that's right. That's so true. There's some things you gotta learn to care and nurture for yourself and to learn those skills, right? And sometimes you get it maybe sometimes you might see a picture of that, what that looks like. Sometimes you gotta just discover it on your own, and that is true. I wanted to ask you, as we kind of move towards the close of our conversation, if you looked in the mirror and talked to yourself, the question is, you looked in the mirror and talked to yourself before you became the woman you are today, what would you say?
I would probably tell myself that you're worthy, um, and you're okay. There's no reason to doubt yourself. There's no reason to question who you are, how you look. You're the person you're supposed to be. And
Mhm.
that's okay. However you show up is okay. You don't have to conform, you don't have to twist, you don't have to make excuses for anything, and you don't have to be what somebody else wants you to be. It's okay to be what you it's okay to do what you wanna do. You don't have to go along to get along.
Yeah. That's it. That's it. I think I don't wanna say all, but I think that is a struggle for many, trying to be what everybody else wants you to be. And it's a struggle and it is a struggle for those in your lives when you decide you're gonna be you. They
It
have a
is.
struggle
They
too
don't like
with
it.
at all. Listen, I've been there and I know, and so they do not like it. Tell me a couple of your daily mantras that you ride with that helps you go through the day.
I think more so than a mantra, it's I'm having to remind myself of those things, like, my mind is telling my heart, that part of me that's soft and squishy, like, "Girl, no." So, what I try to play in my head is a couple things. My favorite scriptures is, Numbers 23:19. God is not a man that he should lie. And I say that, and it's so again, it's so prophetic because I took that scripture on in my very early 20s, and I've kept it with me this whole time, and I think it goes back to me having that intuition and that vision and that what I feel is divine, and it's God no, he is not lying to me, not. So that I admire Muhammad Ali's confidence in telling himself that he is the greatest. And he did that on purpose, he did that on purpose. Be anxious for nothing, all things, make all your prayers and requests and things known unto, and he, let him handle, just don't be anxious. Let God fold it to you as he sees fit.
Mhm.
You just keep pursuing, you keep going forward, and he will bring it, those things. That's what I tell myself.
Excellent. So I wanna just, always ask this question as we transition. What brings you joy? What brings you laughter in your life?
I like to laugh. Anything that's funny, I laugh. I like to laugh. My mom tells me that, and I don't know why she feels, and I don't know why she tells me this, but she says I should have been a comedian. Think so. I think I'm only funny to you. I don't think I'm funny to other people, but okay. But I like to laugh, so I like watching, funny movies. I can find humor in a documentary. I can find humor in a drama. What brings me laughter, I think, a good book. If it's something, just anything that I feel that is, even if it just resonates, it doesn't necessarily have to be humorous. It just needs to
Mhm.
be something that resonates with me, and I like that. I like having aha moments.
Okay, that's
Uh,
good.
yeah, I like those, and I've just started to travel, that brings me a lot of joy. I
Good.
think it speaks to that freedom thing that I've been trying to
Yeah.
claim.
Living. So before we close, is anything else you would feel like you wanna share that you didn't share around the journey? Everything you can envision can be. Everything you envision can be. Anything else you wanna share about that?
I wanna say this, I wanna say that one of the things that I think I took from my sister, who's no longer here with us in life, right, is to be fearless and to take risks. When you are pursuing whatever goal or dream or vision, whatever you call it for yourself, mission, you're going to have to exercise some component of fearlessness and risk taking. And you're not going to get to the place that you really want to be or need to be unless you step out on some faith,
Yeah.
take a risk. You're not. Not everybody's going to understand it. But if it makes sense to you in that inner core being of yourself in the place that you find inspiration, alignment, God, wherever that place, if it's aligning with you and it brings you peace and your cortisol level decreases,
Yes.
voices in your head start to quiet because things are starting to line up.
Yeah.
It was the right thing for you.
Yeah. I love that. I love that. And so we've been talking to Dr. Tanika Davis, and we've been talking about everything you can envision can be her journey to becoming what you dream, or your journey to becoming what you dreamed. And she's given us some powerful, self reflective, honest statements and experiences that I think that are portable. I always look for portable things that when people talk, what can I hear you say that I can apply to my life, and I call these portable nuggets, and she's offered that today. She talked about in the beginning, she came to a pivotal point in her life. It was some loss, it was some pain, it was some kind of internal disconnection between what she had envisioned for her life and what she just kept hearing her internal self or her divine voice tell her. And so she ended the conversation with what she did. She said she took risk and she acted in fearlessness. And so when you think about what does this look like? How do I take my vision of what I believe I'm supposed to be and bring it to fruition? It requires, she mentioned faith in you and faith in God or whatever that is for you. It requires coming back to self and understanding and knowing that you are, as I always say to my clients, the primary principal in your story. Like nobody else is the primary principal in your story but you. And so in order for you to get where you want to be, you got to recognize what you can do in this story. And so she talked about pursuing herself and reclaiming herself. And she talked about she wanted to become a person that loved abundantly, out of her abundance, not out of her lack. And so she's moved herself to a place of being unapologetically free. And so I hope these words mean something to you. I hope as you listen to her share her journey that you can take these things and say, how do I get there? What did she say that I can apply? Can I keep pursuing? If you're somewhere in between the pursuit, if you're somewhere not even started, can I keep pushing towards that thing that I see for myself in my life? Take the risk. Take a chance on yourself. Trust in where God is taking you. Believe that you can be, and believe that the space that you wanna take up in the world, it's waiting for you to get there, and it's purpose for you to be there, and all it requires is that for you to just step forward, one step at a time. It may not always be pretty, you may not always have encouragers, but if you know that's where you're supposed to be and it brings you peace as she indicated, and the voices start to dissipate, and your cortisol levels go down, you're in the right place. I don't want those honey, that stress level is something else. You're in the right place. So this has been Dr. Lisa Cook. This is the Coming Out Forums. We always tell you, share the podcast, let people know what we're doing here. We thank you for being here as always close. Peace. As always, we thank you for listening to the Coming Out Forums. It's now your opportunity to do one of three things. Share, subscribe, and leave a comment for us. Let us know how the Coming Out Forums is impacting your life. We'd love to hear from you. As I always say, peace.